PACT, which is our police and crisis team. That's the acronym we use, is PACT. It's a partnership between the Edmonton Police Service and Alberta Health Services, and it puts an EPS constable in an unmarked police vehicle with a mental health therapist from AHS. And the two co-respond to incidents of mental health crisis within Edmonton. So there's 8 constables assigned to the team. Every day we deploy 4 teams, 2 teams during the day, 2 teams during the evening, and their focus is exclusively on responding to mental health calls throughout the city. If it's safe to do so, they will be the first point of contact for that client that's potentially in mental health crisis. As in EPS, we appreciate we're not mental health professionals. We're good at what we do. We're good at our tactics, and we do have de-escalation training, but we really need our mental health professionals to get to the scene safely, to provide the client with the addictions or mental health supports that they need. The officers that are selected to work in PACT are heavily scrutinized prior to being selected for PACT. Every officer that applies for PACT is screened by our professional standards branch. They're going to go through a litany of reference checks, interviews, written exams, and we're looking for police officers that are high in empathy, high in emotional intelligence, patient, they're excellent communicators, while still being tactically sound. Once selected, we train our officers and PACT up in trauma-informed care, addictions and mental health training through AHS, suicide prevention training, harm reduction, motivational interviewing. We provide them all the courses that they're going to need, but to be honest, the best training they get is from working in a patrol car with a mental health professional every day.
The way that our officers present themselves, present the situation, how we work together, it really does lend to de-escalation as opposed to escalation. There are of course individuals who don't want anything to do with police. Why are you here? I didn't do anything wrong. Don't arrest me. And we work really hard to tell them that we're there to help. We're not there to get them in trouble, right? Especially when it's, or particularly when it's due to substances. Well, I don't want to tell police anything because I'm just going to get in trouble if I'm doing something wrong. And having that interaction with police where they really aren't getting in trouble, they're being listened to, they're feeling heard, and they're perhaps in the end getting some supports and services that they didn't have to start with. Now they've had an experience with police where it actually makes them more inclined to have those neutral or positive interactions with police in the future.
PACT is kind of the perfect example of two different professions that are both determined to serve that client, but also protect them. And that's kind of the model of what EPS, serve and protect. And so, given that we respond together, and given that our model, like my partner mentioned, is not necessarily for any kind of punishment or criminal investigations. Now, that's not to say that I can't handle that if it does come up. But when we go, we specifically, with PACT, we specifically avoid laying charges or doing any of that kind of thing so that we can preserve that relationship that we have with the client. And again, like I said, if information presents itself or a situation presents itself that I need to act on because of a risk to myself or to the community or to my partner, obviously I am required to act on that. But again, in general, as the police and crisis team, when we respond to things and that does present itself where it escalates because I'm in uniform or because I have a gun, it's great to be able to say confidently, you're, like my partner said, you're not in any trouble. We're here to help. And that's the message that we bring with us.
A lot of the work is done without the help of police, but when it comes to, like Jake mentioned, those safety concerns, some unpredictable behavior, whether it's due to substances or someone's mental status, when it has to do with, we really think the only way to get this person the help they need is to get them to the hospital. Again, that's where police partners are essential in making sure that we can, as mental health providers, safely get to the people that need our help.
Again, these days, being in uniform and thinking things won't get escalated is kind of naive. It does still happen, very much so. that's, again, out of my control. The only thing that is in my control is how I address that and the messaging that I bring.